let's talk about architecture and tech debt and those kind of things. So one of the things that struck me is you were actually going out and looking for hiring an architect to put in place. What's the need for architecture within health IT, and why do you see that role as important?
Sure, I think it's a good question because as a vertical, I think historically we've thought that having our core systems, whether it be electronic medical records or ERP systems or those kinds of major systems, was enough, and whatever wrapped around that, whether it was your Citrix infrastructure or your data and storage, all that stuff was pretty straightforward because you were serving these major applications. And of course, we all know we run hundreds and hundreds of other applications, but that was really the focus. And in those days, maybe you had a lab system as well. In those days, perhaps things were a little more simple, perhaps. But as we've learned from all other industries, is that really it's an ecosystem of applications that drives value. And for healthcare organizations, there just has not been the uptake on thinking through how to purposefully create architectures and ecosystems that advance the organization. It doesn't mean others don't have architects. I think a lot of people do, but it's in healthcare in general, it's not been a prevalent discipline. And particularly for smaller organizations, perhaps there really isn't even a need if you're a small or mid-sized healthcare delivery system. But for us, at a major academic medical center with many partners, clinical and academic partners in the ecosystem, our ability to interoperate with them is even more critical. And as we do things like open up our new building, which is a $2 billion facility that will have the latest and greatest of technology, we are dealing with things like the Internet of Things. We are looking at serving people when they're at home or off campus. We have employer-based clinics. We have over 70 locations in the Bay Area, and we have partnerships with other healthcare organizations. And even just on campus, when we want to interoperate for medical research or to support other initiatives in the School of Medicine, our ability to serve data up or to lower the friction, if you will, in working together is critically important.